Caesarean section in sows, from laparotomy to aftercare. So for preparation, you clip the hair, you scrub with iodine, and use a brush, and use alcoholic swabs. You do one passage and then you throw it away. And you also infuse the incision site with 2% lidocaine. For the laparotomy, the animal can be in lateral or dorsal recumbency. Lateral recumbency with a vertical incision is best. Grasp the peritoneum with forceps and then puncture and incise carefully. Make sure you use wet gloves before entering the abdominal cavity. Then locate the uterus bifurcation and exteriorize. Then doing a longitudinal excision along the greater curvature of the uterus, which is close to the bifurcation. Make the incision and then start removing the piglets. Try and deliver as many piglets as possible through one incision. And remove the placenta if loose, and if it's tight, don't disturb it. For the final check, make sure there's no remaining piglets in the pelvis or the birth canal, and remove any blood clots from the uterine wall, and then replace the uterine horns into the abdominal cavity. For suturing the uterus, use 1 to 2 absorbable sutures and use Lembert or Cushing in 2 layers, and then rinse and then replace it back into the abdominal cavity. When closing up, the first is the peritoneum. Use an absorbable suture and use a simple continuous pattern. The second step is the muscle layer. Use absorbable sutures and use a simple continuous pattern. And then when doing the skin, this is a heavy suture, so use non-absorbable sutures and then they need to be removed. And also use an interrupted pattern. For the aftercare, have intrauterine antibiotic tablets. Then also give PGF2 alpha as an intramuscular injection, and this helps with luteolysis and healing. And also give long-lasting antibiotics orally twice a day, every 2 days. And then give oxytocin around 3 to 5 times a day to help with uterine involution. And also give NSAIDs such as ketoprofen to help with pain relief. And then remove the skin sutures after 2 weeks or 3 weeks.